Both my parents work here as nurses, so I got to grow up seeing them come home and listening to their stories about what they did at work, and it was always very interesting to me. I started here as a patient care tech on 3 Northwest, and that was honestly so amazing for me. I did not realize how much working on that floor was going to give me such a good foundation.
Congratulations. You are the first recipient of the Mary Newcomer Scholarship, as well as additional funds as a foundation scholar.
My first scholarship for my first year of nursing school was the Mary Newcomer Scholarship, and then my second scholarship for my second year of nursing school was from the McCurdy Family Scholar. And it was so helpful because I didn't have to work as much. I didn't have to stress out about, oh, I need to go work overtime, and I really don't have time to do that because I have 2 days of class this week, and I also have clinical and homework, and I have to study. And so thank you so much. It meant so much to me, and more than anything, it means so much knowing that when we come to work, there are people here who believe in us and believe that we're going to be good at our job and believe that we are capable of getting that degree is absolutely amazing. I couldn't imagine not having it anymore. So.
The middle school has the Hygiene Closet. It is an area where they've had donations of all sorts of different hygiene products, whether that's deodorant, toothpaste, shampoo, soap, menstrual products. If they forget their products to shower after gym class, or if they don't have access to things at home. And especially for the middle school age kids, when their bodies are changing and things are awkward, if having access to an extra toothbrush or bar of soap makes things a little less awkward for them, then we've benefited those students. Newcastle is a smaller community. It's pretty large geographically. Not all of the community is walkable. It's wonderful to see the foundation giving to not just Norman, but the surrounding communities. I'd like to thank everybody who has contributed to the foundation.
I was coaching my granddaughter's 3rd grade basketball game. During a timeout, I suffered a cardiac arrest. My eyes just kind of got big, and next thing we knew, I just was out on the floor. Luckily, the gym was full of lots of qualified people to take care of that kind of situation. They immediately rushed to my aid. Firefighters started giving me CPR. 10 or 12 minutes, personnel showed up with a breathing apparatus. A few minutes later, the AED showed up. They shocked me 3 times and got my heart beating. You know, I've talked to quite a few of the firemen, and they can count on one hand how many people survived a cardiac arrest. Because of that, I feel real strongly that making sure that there are the AEDs available at all the gymnasiums in all these little towns that we participate in. I just really can't express how grateful I am for the foundation and for Norman Regional. The machines, I don't know the exact cost of them, but I'm sure it can be cost prohibitive for some of these smaller programs.
We have a Fitness Works, and it is a 24/7 free badge in, badge out for our healers. Treadmills are probably 3 times more likely to be used than any equipment in Fitness Works. The foundation, they have given us so many different opportunities to really help with our health and wellness here within the walls of the hospital. We are supposed to be getting at least 30 minutes of exercise every day. And when you work 12-hour shifts, that's hard to do. They are able to access that on their breaks, during lunchtime. We want to make sure that they have the equipment that they can use to exercise, de-stress. Just like equipment we need for our patients, we do need equipment for our healers as well.
It means a lot to a lot of my colleagues that we have an escape.
This was an idea that was created during COVID. The ICU nurses, nurse residents, needed a respite place to go and just decompress or just pause and take a break. We researched and studied and found a lot of other hospitals around the country have these rooms.
They have been a lifesaver for some of me and my colleagues. Just when we're having a rough morning or just a time where we need to decompress, we'll come up here about 15 minutes and just relax. It's super quiet. There's no clinical things going on in here.
It's just a calming, peaceful room.
Even if it's just for a few minutes, when you're in the midst of a busy day, when you have that moment, it means a lot that there's a place like this to go.
Richie split. He saw other hospitals or other places doing it. Porter's been a great dog. I've met so many people. Hey guys, say good morning. That's what I get from staff, that this is the best thing that the hospital has ever done. He said, I've been waiting for you guys. We've been to the ICU and we've had a patient that missed her dog, and so the family asked if Porter could come in. It really made her smile, made her happy.